today on The Bill Kelly Show on 900 CHML.
Our next finalist, Emerge Connect, is an early-stage health IT startup. Ron Galev is the CEO of Emerge Connect, and he joins us on the program. Ron, thanks for the time. Good to have you with us today.
Thanks for having me. Great to be here.
Healthcare is the number one issue for everybody all the time, not just during election campaigns, but in our everyday lives. So you guys have really, I think, connected here, if I can use the bad pun here, with Emerge Connect. Talk to us about how the system works.
Sure, absolutely. So for patients, Emerge Connect is really a simple mobile app that asks yes or no questions and uses machine learning natural language processing to determine the reason that you're seeking same-day care. But on the back end, we have proprietary research-developed systems that predict triage scores, conduct triage analysis, rule out high-risk patients and de-risk, and predict individualized wait times. And then on the hospital end, all of it is seamlessly integrated through our Emerge Connect portal or through their existing systems.
So this is a cooperative event here. You got to get a lot of support here, and I know that you've had discussions already with St. Joseph's Healthcare and Hamilton and others as well, I would think.
Yes, absolutely. So we've received a ton of support from our partner institutions. So our project is approved at Sunnybrook Health Sciences. We're very close to approval at William Osler Health System, and we're also in the final stages with St. Joe's Healthcare Hamilton. So we're hoping to launch our product in this sort of 3-site pilot across GTA Hamilton in the coming months, so we can give this service to as many patients as possible all across GTA Hamilton.
Well, one of the most stressful things if you have to visit an ER, of course, is the triage element of it. I mean, the hospital needs to get information from you about what's going on and even your history, if at all possible. And you're usually in a very stressed out situation because you're in an ER. This takes a lot of that pressure off, I would think, Ron.
It does, and not only for patients, but also for the staff in the hospitals. Right now, there's a big problem where there just isn't enough nurses to go around, and there's this huge influx of people going to the ER. And our system at its core, aside from helping patients, helps nurses. It helps them spend less time on the repetitive tasks like typing in the computer or collecting basic patient information, but more time actually talking to the patient, critically thinking, and helping the patients in their ER experience.
How do you get the word out on something like this? It's great to see folks like St. Joe's and Sunnybrook in Toronto and others that are getting a great deal of interest in this because I'm sure, as you just described, they see a huge advantage for them in this, not just for the patients, but getting the word out there so people are aware of this and how effective this can actually be. How do you go about doing that?
So that's a very interesting and rather complicated question. Healthcare institutions are very much like investors where they don't really take cold connections. So we had to do it through early networking. And as any sort of healthcare company has seen, the key to getting into these institutions is a clinical champion. So we have fantastic members on our team who act as clinical champions within these institutions. And they help us navigate the internal landscape and the bureaucracy within these institutions to actually get through these approvals. Because even after you have buy-in from the departments, you've gone through everyone saying that this is amazing, we want it, there's a huge amount of work that needs to be done just to get it through approvals, to get it through IT, to get it through the many, many, many steps before a patient can actually see it.
So this is going to take an awful lot of support to try to get this whole thing off the ground. And that's why I'm glad you're involved with the LionStar competition, as we were just talking about with Amy a couple of minutes ago. The support that you get and the networking, which is going to be so very important here, is there for you, isn't it?
Absolutely. I completely agree. LionStar has been a really interesting and unusual pitch competition in that it's not just one event where you pitch, but it's actually a 3 to 4 month long process where Innovation Factory works with each of the companies that are finalists in the competition and gives us support throughout the process, and it's been very valuable.
Well, I wish you the best with this. This is an outstanding idea, and as I say, people are concerned about healthcare. They're concerned about wait times once they get into the ER, and this is, I think, going to streamline the process, which is why I'm not surprised at all that these other institutions are so interested in this. Good luck with this going forward. Good luck in the competition, first of all, Ron, and good luck with this going forward. I really think it's going to do well.
Thanks so much. I really appreciate that.
Take care. Ron Galev, who is the CEO of Emerge Connect, and another one of the finalists in the LionStar competition.
The Bill Kelly Show, weekdays from 9 to noon on 900 CHML.